Good day, all. In this session, we are going to discuss about the anatomy of scalp, Part 1. The clinical anatomical significance regarding scalp will be discussed under Scalp 2 later. First, let's see the specific learning objectives. At the end of the class, the student must be able to understand the following: layers of scalp, the names of all 5 layers and their features. Demonstrate the layers of scalp and the clinical anatomical significance regarding each layer of scalp. Before seeing the anatomy of scalp, we must see some important surface landmarks: the forehead, the nose, the palpebral fissures and eyelids, the oral fissure or mouth, the external ear, the superciliary arch. Let's have a brief regarding the superficial temporal region. It is the area between the superior temporal line and zygomatic arch. This area contains the following 6 layers: skin, superficial fascia, thin extension of epicranial aponeurosis, which gives to extrinsic muscles of the auricle, temporal fascia, temporalis muscle, pericranium. The temporal region is named on the term tempos, means time. As graying of hair first starts here, this region is called as temporal region. Let's define scalp first. The soft tissue covering the cranial vault forms the scalp. Let's see the extent of scalp. Scalp extends anteriorly to the superciliary arches and supraorbital margins, posteriorly to the external occipital protuberance and superior nuchal lines, on each side to the zygomatic arch and external acoustic meatus. As the temporoparietal fascia, the extension of epicranial aponeurosis extends from the superior temporal line to zygomatic arch. Scalp is made up of 5 layers. The term scalp itself is the mnemonic of scalp, and the layers are skin, connective tissue or superficial fascia, aponeurosis. This layer contains the deep fascia in the form of the epicranial aponeurosis or galea aponeurotica with the occipitofrontalis muscle. The 4th layer is the loose areolar tissue and the pericranium. Let's describe the layers of scalp individually. The first layer is S, the skin. The skin is very hairy and adherent to the epicranial aponeurosis through the dense superficial fascia. The skin of scalp is provided with maximum number of sweat glands and sebaceous glands. For this reason, scalp is the commonest site of sebaceous cysts. The second layer of scalp is C, connective tissue layer. It is otherwise called as subcutaneous or superficial fascia. This layer is more fibrous and arranged into small locules filled with fat. It is dense in the center than at the periphery of the head. The blood vessels and nerves of scalp present in this layer, and the superficial fascia binds the skin to the underlying aponeurosis. The third layer is A, aponeurosis. It is otherwise called as epicranial aponeurosis or galea aponeurotica, is the deep fascia present below the connective tissue layer. It is freely movable on the pericranium along with the overlying and adherent skin and fascia. Anteriorly, it receives the insertion of the frontalis muscle, and posteriorly receives the insertion of the occipitalis muscle. Posteriorly, in between the occipital bellies, it is attached to the external occipital protuberance and to the highest or superior nuchal lines. On each side, the aponeurosis is attached to the superior temporal line, but sends down a thin expansion which passes along the temporal fascia as temporoparietal fascia, and attached to zygomatic arch. Let's see a brief description about the occipitofrontalis muscle of the third layer. The occipitofrontalis muscle has 2 bellies: occipital belly or occipitalis, and frontal belly or frontalis. Let's see the frontal bellies first. The frontal bellies are longer, wider, and partly united in the median plane. Origin: the frontal bellies arises from the skin of the upper eyelid and forehead, mingling with the orbicularis oculi and the corrugator supercilii. Insertion: the frontal bellies are inserted into the anterior aspect of epicranial aponeurosis. Nerve supply: the frontal bellies are supplied by the temporal branch of the facial nerve. The occipital bellies are small and present separately. Origin: occipital bellies arises from the lateral 2/3 of the superior nuchal line. Insertion: occipital bellies are inserted into the posterior aspect of epicranial aponeurosis. Nerve supply: the occipital bellies are supplied by the posterior auricular branch of the facial nerve. Action of occipitofrontalis muscle: This muscle raises the eyebrows and produces horizontal wrinkles in the skin of the forehead, as seen in the picture. The fourth layer of scalp is L, loose areolar layer. This layer of the scalp is made up of loose connective tissue. Loose areolar layer extends anteriorly into the upper eyelids, as the frontalis muscle has no bony attachment. Posteriorly, this layer extends to the highest and superior luteal lines, and on each side extends to the superior temporal lines. The fifth layer of scalp is P, pericranium. The fifth layer, pericranium, is the periosteum of the skull bones and is a fibrous, membranous structure, covers the external aspect of each skull bone separately. It is loosely attached to the surface of the skull bones and firmly adherent to the endocrinium at the sutures and so takes the shape of the bones. Till now, we have seen about the layers of scalp along with the occipitofrontalis muscle. Next, let's discuss the nerve supply of scalp. Scalp is supplied by 10 nerves each side. Out of this 10, 5 nerves supply in front of the auricle and 5 nerves supply behind the auricle. Out of these 5 nerves, 4 nerves are sensory nerves and 1 motor nerve in front and behind the auricle. The table shows the sensory nerves supplying the scalp in front and behind the auricle. The sensory nerves supplying in front of the auricle are supratrochlear nerve. It's a branch of the frontal branch of ophthalmic division of trigeminal nerve. Supraorbital nerve. It's a branch of the frontal branch of ophthalmic division of trigeminal nerve. Zygomatico-temporal nerve. It's a branch of the zygomatic branch of maxillary division of trigeminal nerve. Auriculotemporal nerve. It's a branch of the mandibular division of trigeminal nerve. The sensory nerves supplying the scalp behind the auricle are posterior division of great auricular nerve, formed of ventral primary rami of C2, C3 spinal nerves from cervical plexus, lesser occipital nerve, formed of ventral primary rami of C2 spinal nerve from cervical plexus, greater occipital nerve, formed by dorsal primary ramus of C2 spinal nerve, third occipital nerve, formed by dorsal primary ramus of C3 spinal nerve. Let's see the motor nerve supplying the scalp. The branches of facial nerve is the motor nerve supplying the occipitofrontalis muscle of scalp. The frontal bellies are supplied by the temporal branch of facial nerve, and the occipital bellies are supplied by the posterior auricular branch of facial nerve. Let's discuss the blood supply of scalp. Scalp is supplied by 5 arteries on each side. Among that, 3 arteries supplying in front of the auricle and 2 arteries supplies behind the auricle. The arteries supplying in front of the auricle from before backwards are supratrochlear artery, supraorbital artery, and superficial temporal artery. Among that, supratrochlear and supraorbital arteries are branches of ophthalmic artery from internal carotid artery, and the superficial temporal artery is one of the terminal branch of external carotid artery. All the 5 arteries anastomose form a network over the scalp and supply the scalp. So the network of arteries over the scalp is a communication between the internal and external carotid arteries. The arteries supplying behind the auricle from before backwards are posterior auricular artery and occipital artery. Both are branches of the external carotid artery. Thus, the scalp has a rich blood supply from both the internal and the external carotid arteries. Let's see the venous drainage of scalp. Venous drainage of scalp goes along with the venous drainage of face, as shown in the picture. The venous blood from the anterior aspect of the scalp is drained by the supratrochlear and supraorbital veins. The supratrochlear and supraorbital veins unite at the medial angle of the eye and form the angular vein, which continues down as facial vein. Laterally, the scalp is drained by the superficial temporal vein. The superficial temporal vein descends in front of the ear and enters the substance of parotid gland, joins the maxillary vein to form the retromandibular vein. The retromandibular vein divides into 2, the anterior and posterior divisions of retromandibular vein at the level of apex of the parotid gland. The anterior division of the retromandibular vein unites with the facial vein to form the common facial vein, which drains into the internal jugular vein. The posterior aspect of the scalp is drained by occipital vein and posterior auricular vein. The posterior auricular vein unites with the posterior division of the retromandibular vein and forms the external jugular vein. External jugular vein ultimately drains into the subclavian vein. The occipital vein terminates in the suboccipital venous plexus. Apart from the extracranial veins, scalp is also provided with emissary veins and diploic veins. What are emissary veins? The small veins of scalp that connects the extracranial veins with the intracranial venous sinuses are called as emissary veins. These veins are valveless and equalize the pressure between the intracranial venous sinuses with the extracranial veins. We have two sets of emissary veins present over the scalp. They are the parietal emissary vein, present one on either side, passes through the parietal foramen and enters the superior sagittal sinus, and the mastoid emissary vein, present one on either side, passes through the mastoid foramen to drain into the sigmoid sinus. These veins may serve as a source for the spread of extracranial infections into the intracranial venous sinuses. So, what is a diploic vein? The small veins drains the diplo or cancellous bone within the two tables of skull bones are called diploic veins. They are thin-walled and valveless. They carry the newly formed blood cells into the general circulation. There are 4 veins on each side of scalp. They are frontal diploic veins, anterior temporal diploic veins, posterior temporal diploic veins, occipital diploic veins. Let's discuss the lymphatic drainage of scalp. The anterior part of the scalp drains into the preauricular or superficial parotid lymph nodes, situated on the surface of the parotid gland. The posterior part of the scalp drains into the posterior auricular or mastoid and occipital lymph nodes. Efferents will primarily drain into the superior deep cervical lymph nodes, or the jugulo-digastric nodes, present along the internal jugular vein. With this, we completed the gross anatomy, blood supply, nerve supply, and lymphatic drainage of scalp. The clinical anatomical significance of scalp will be discussed as Scalp Part 2 in the next session. Have a nice day.